Did you know that more than 264 million individuals around the world suffer from depression, which is a prevalent mental condition? Welcome back to my channel. Today I will be providing you with information on depression. I will also examine this topic from the perspectives researched and published by the Mayo Clinic NHS Beyond Blue organization. Those are the mental health and medical bodies that I have, gotten these information from. Now, consistent sorrow and lack of interest in formerly fulfilling activities, um, it's the defining traits for a melancholy feeling, and depression is a mental condition that can be quite crippling. For the most part, depression is a state of hopelessness, and you constantly have the impression that you are just going through life, and a good night's sleep becomes like a fantasy. Then, sometimes you're not able to recover from your mental exhaustion, that you will never be able to rejoin the outside world. You have that feeling, and you never have the slightest bit of pleasure from doing anything. Now, your vitality and zest for life are sapped by these symptoms. It's understandable why many people's personal and professional life eventually crumble after a while. Now, depression won't go away on its own, whether you like it or not. So it's important that you get assistance or urge a loved one who is depressed to do so. Now, since depression is a cyclical disorder, it just don't disappear on its own. A second depressive episode occur in more than half of those who suffer one. So there's an 80% chance that there will be a third occurrence. And if it occurs twice, then there might be a third one. So treatment can hasten your recovery as well, become more aware of your depression patterns. That enables you to foresee when there's going to be an episode to formulate plans of action. So, my dear busy moms, there are many forms of depressions, and one such type that I'm going to be talking about today is called clinical depression. And some of the causes for clinical depression are stressful events. Most people take time to come to terms with stressful events, such as a bereavement or a relationship breakdown, personality, family history, giving birth, loneliness, alcohol and drugs, and illness. Now, depression symptoms can vary from mild to severe, and it may include feelings of being sad or having a depressed mood, loss of interest or pleasure in activities that you once enjoyed, and also there is change in your appetite. You might have weight loss or weight gain, which is unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity such as inability to sit still, pacing around, wringing of the hands, or slowed movement or speech, and these actions must be severe enough to be observable by others. And there's also a feeling of worthlessness or guilt. Now, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide, sadness, tears, emptiness, or a sense of helplessness, irrational behavior, impatience, or frustration, especially over trivial issues, loss of enjoyment or interest in the majority or all of the typical activities such as hobbies, sports, sleep disorders, insomnia, excessive sleeping. These are some of the signs that can indicate that you might be going through something. So, my dear busy mom, some of the effects of depression are: the depression has physical effects in addition to mental ones. You have constant weariness, irregular sleeping patterns, you lose your appetite, you can have muscular aches, you can have headaches, back pain, and those are just a few physical symptoms. So, my dear busy moms, you might be wondering, can clinical depression be overcome? Clinical depression are not the only ones, these people are not the only ones coping with this condition. It's one of the most prevalent and curable mental health conditions. So people can take control of their symptoms and they can feel better and resume enjoying life with the help of early detection and ongoing therapy. So, my dear busy moms, you may also be so serious as to what treatment options exist for clinical depression. You might ask. Now, for mild depression that is not getting better or moderate depression, talking therapies like cognitive behavior therapy, CBT. That's called cognitive behavioral therapy, CBT. These are frequently employed. Antidepressants are given usually administered as well. Now, a combination of talk therapy and medication is frequently used for mild to severe depression. Let me inform you that the specialist states that clinical depression transpires in the brain. An MRI research found that people with depression had lower hippocampal brain activity. Some activity in the brain gets lowered. So in depressive patients, there's a decrease in some gray matter in your brain, decrease in the gray matter volume, and decrease in the functional ability of the hippocampus. Now these are medical terms that I hope that you busy moms will go and Google to see where in the brain is the hippocampus. And this results in unpleasant feeling and the inability to progress with cognitive information. So my busy moms, the duration of clinical depression, you may have depression if you have been exhibiting some of the following symptoms for the day, almost every day, or for at least 2 weeks, persistently depressed, worried, or empty mood feelings of pessimism or hopelessness. Now, how do medical professionals test for clinical depression? They may do an X-ray or lab test, cannot be used, by your doctor to identify depression. Instead, clinicians must elicit information about your emotions and behavior. So they may not get this through X-ray and lab tests, how, depression is. They might just ask you based on your emotions and behavior in order to develop a diagnosis. Now, to rule out other potential causes for your symptoms, doctors may perform physical examination. They may request even a blood test. Now, you might ask, how may clinical depression be treated? Now, is it possible to stop depression? So, by helping getting adequate sleep, maintaining a nutritious diet, and engaging in regular self-care like yoga, meditation, and exercise, you can help to prevent depression. If you struggle with depression, you could be more prone to getting it again. So get assistance if you have depression symptoms. Let me repeat, a medical professional identifies a patient as having clinical depression, not your friends, not your children. Go to the doctor if you're having symptoms. You should visit your doctors if you're having these depression symptoms for at least, if you're experiencing it for continuous days and weeks. The general practitioner should be consulted, if you're having those symptoms, not your friends. So you might ask, can depression lead to long-term brain damage? Well, a depression can permanently harm the brain, causing long-term memory loss and concentration problems, in addition to making a person feel sad and depressed. So sometimes some people go through depressive symptoms, some recover and some don't, according to the medical experts. Now, you might ask, what is depression's last stage? Depression make you feel alone, as if you are wandering aimlessly through a desert. The last stage is acceptance, meaning you finally come to terms with the fact that you have a mental condition. So my dear busy moms, if you exhibit any of these signs, go and get medical attention. You might ask, what depression subtype is the most severe? Well, clinical depression is the most severe and dangerous form of depression, commonly referred to as a major depression or major depressive illness. So let's look at vision and depression. Now, my dear busy moms, the following vision issues are more likely to affect those who are clinically depressed or experiencing times of extreme stress. Blurred vision, people may not be able to notice minute details properly due to loss of clarity in your vision. So my dear busy moms, if you have watched this video and notice any of these symptoms where you feel sad or an extended period of time. So if you experience sadness for an extended period of time, please go and see a therapist to get help before it's too late. Please don't overlook your mental health, my dear busy moms. Your mental health is equally important as any other health areas of your life. Every area of health in your life is equally important. So take care of your mental health and all other aspects of your life. It's more important, because if you are not mentally strong, my busy mom, it cannot make you it can make you physically weak. So if you are not mentally strong, it can make you physically weak. So check the link in the description box below to see the list of more awesome informative videos such as decluttering, investing, fitness, parenting tips, among others. I hope you enjoyed viewing this video as much as I enjoyed creating it for you. And I advise you to subscribe, share, leave a comment below so we can see how you're going through and how you cope with feelings of sadness, so that other busy mom can learn how you cope with feelings of sadness, my dear busy mom. I invite you to join me when I upload another video for you busy mothers out there. Alright, so hit the notification bell so that you will know when I upload yet another video. And make sure that you take care of your mental health. You are the only person that can take care of you as best as possible. Like I said, if you're experiencing any of these symptoms of depression and sadness for extended period of time, my busy mothers, do not hesitate to go to your doctor or your therapist. Your healthy mental state will help you to make wise choices for you and your family. So until next time, my busy mothers, remember, go back and watch this video so you can see all the symptoms that may give you an example if you are going through your mental health condition of depression. If you're having any symptoms, more than one, extended sadness, go check it out. All right, see you next time. Bye.